Good afternoon, Your Excellencies, ladies and gentlemen, and a very warm welcome to this session on reinventing international health cooperation through realization at this year's Paris Peace Forum. It's a great pleasure to be here. My name's Eloise Todd, Executive Director of the Pandemic Action Network and your moderator for this session, in which we'll explore how we can learn lessons from the COVID-19 crisis, learn from best practice, and explore ongoing efforts to build sustainable health production ecosystems in Africa through regional development and, crucially, interregional cooperation. Let's meet our distinguished panelists for this session. It's my great honor to introduce Her Excellency, Votre Excellence, Madame Tall Sall, Ministre des Affaires étrangères et des Sénégalais de l'extérieur. His Excellency, Dr. Vincent Biruta, Minister of Foreign Affairs of Rwanda. And it gives me great pleasure to welcome our host here in Paris, Ministre Zakharopoulou, Secrétaire d'État au développement, à la francophonie et aux partenariats internationaux. We'll have a discussion between panelists and then move to the floor for a Q&A, hopefully we'll have time for. We've got plenty of questions to get through, so let's dive in. Firstly, I'd like to get our distinguished panelists' view on the role of regionalism in this era of pandemic threats. And if I can address Minister Tall Sall, qu'avons-nous appris de la COVID en termes d'importance régionale?
How important it is to take a regional approach.
Merci beaucoup.
Thank you.
Permettez-moi avant tout de saluer tout le monde. Bien sûr, ceux-là qui sont dans la salle et qui nous font l'honneur de venir nous écouter et certainement d'interagir avec nous, mais également ceux avec qui je vais échanger ici sur ce présidium. Et remercier très chaleureusement la France, mais Madame la ministre Chrysoula, qui a pensé qu'il était important, sur ce grand thème général autour des crises, que la France veut que nous puissions prendre en compte d'avoir ce point particulier sur ce que nous avons appris en termes de coopération, en prenant l'exemple de la COVID-19. Je pense que c'est un point extrêmement important.
This is a very important matter. We have learned two things. We have learned that when it comes to health, as in many other areas, cooperation and multilateralism are of vital importance because every day we are reminded that we inhabit one and the same world and that our national selfishness tends to blind us to the fact. And COVID has served to remind us of this. There can be a breakout somewhere, and the fact that it has broken out in a far corner of the world does not mean that it will not reach you. So we must, and the UN has begun to do this, as have many other fora, we must re-examine multilateralism and develop it further in our diplomatic work and other initiatives. As ministers of foreign affairs, and you need only look at the example of Anthony Blinken, we foreign ministers are convinced that health is a matter for diplomats to take up and champion. And as we have also learned from the COVID epidemic, we were all vulnerable. We are all vulnerable, and we must join forces to withstand such scourges at regional level. That's where it starts if we are to make inroads internationally. I am from Africa, and I am from Senegal, which is a flagship country of the African continent. Mr. Macky Sall, our president, also chairs the African Union. Africa was determined to make an organized effort to fight off the pandemic, and the pandemic only accelerated this movement which had already begun. We have an organization in Africa, Centers for Disease Control, which is where diseases are studied and solutions are sought. Africa is working to find solutions to prevent disease, to fight disease, and to do so on an ongoing basis, and to do so sustainably, because, as is well known now, we can expect further outbreaks of new pandemics every decade, and we cannot sit by and wait to be hit by the next pandemic. Africa has thus organized its efforts at regional level with this CDC. We seek autonomy and we seek sovereignty in the fight against these pandemics. The pandemics of today, the pandemics that we are still fighting, have been fought with vaccines that were devised for that particular purpose, but many people went unvaccinated and died of the virus. We are determined to mount a concerted effort to prevent this reoccurring. We have manufacturing facilities where we can produce anti-COVID vaccines, but many other vaccines to prevent diseases that are endemic, malaria and other diseases that are still at large. We have also understood that through cooperation, through mutual assistance, through sharing of knowledge, we will emerge from this crisis. And again, this is work done at regional level, but it is also done at continental level, and then with the help of WHO, it is work being done internationally. COVAX has been a powerful scheme in the onslaught of COVID. Millions of doses were distributed and injected, and many Africans were protected in this way. I must thank Minister Ursula, who played a critical role in COVAX, and I must also thank the entire European team. I must thank France and recall that only through cooperation, only through multilateralism will we succeed. Only in that way can we address security conflicts or health conflicts. Thank you very kindly for your attention. Thank you.
Building on what you've just said, I'd love to ask Minister Biruta, if I may turn to you first, what you think are the necessary ingredients to build this kind of regional hub in Africa. What would be the key ingredients that would determine the success or failure of making the African region stronger, given all the lessons we've learned from COVID? Thank you.
Thank you. As already mentioned, during the COVID-19 pandemic, Africa was the last continent to get access to vaccines. And the continent was actually struggling even to get access to other pharmaceuticals to be able to fight COVID-19. And we have drawn lessons as a continent from this pandemic. And the ingredients, I would put them into two categories. First of all, there is the ecosystem, which is needed for us to produce vaccines and other pharmaceuticals, which would allow us to fight against the next pandemics, even the current one, because COVID-19 is still here. Second important ingredient is the partnerships. By ecosystem, what I mean is that we need not only to have the manufacturing capacity, and here I'm referring to the technology to produce the vaccines and other pharmaceuticals, but we need also to have the regulatory framework in place at the national level and at the continental level. At the national level, I would mention that in Rwanda we have the Rwanda Food and Drug Authority that we need to build to put it at the right level to be able to regulate the pharmaceutical sector. At the continental level, we have the African Medicines Agency, which will be headquartered in Kigali, Rwanda, and it will enhance the capacity of state parties and the regional economic communities to regulate medical products in order to improve access to quality, safe, and efficacious medical products on the continent. The African Medicines Agency will join another important organization on the continent, which is the Africa Center for Disease Control and Prevention, Africa CDC. Both organizations will go a long way to support the fight against pandemics on the continent. The third element is, of course, related to the skills we need on the continent to be able to be part of this network of production of vaccines and pharmaceuticals. To succeed, we need to strengthen our skilled workforce, and we need to invest in training, in reskilling and upskilling the medical or biomedical experts we have on the continent. And in addition to all these, we needed to have resilient health systems, because we can get vaccines, we can get the skilled people, you can get the regulatory framework in place. But if we don't have a network of hospitals, health centers, and the logistics in place, you could not even be able to distribute and administer the vaccines. Because what you need is not just about production, it is about just putting the vaccines at the disposal of the population. We need to administer the vaccine to the people who need it. This is about the ecosystems, and the second ingredient I referred to is the partnerships. In Rwanda, we have partnered with BioNTech to start production of mRNA vaccine in collaboration with other African nations like Senegal, Ghana, Morocco, and South Africa. So those partnerships are needed in terms of technology transfer, but we have also been benefited from the support of the European Union, France, Germany, to be able to start production of vaccines in early next year. So once again, the ingredients we need is to have the right ecosystem in place and to have the partnerships we need to be able to start production. And we need resilient health system which can allow us to distribute those vaccines and administer them when we have them. Thank you.
Thank you. I'm glad you mentioned that partnership with the European Union and France and Germany. It brings me to my next question, turning to Minister Zakharopoulou. There was some fantastic momentum earlier this year under the French presidency of the EU, shown at the African Union, European Union summit, and all the actions taken afterwards. How can we continue the momentum around that inter-regionalization process? And what's your perspective on how to best do that?
Merci beaucoup, Héloïse. Et tout d'abord, permettez-moi
Thank you very much, Eloise.
de vous dire merci d'être venu ici.
I would like to thank you very kindly for having
Vincent,
agreed to
je pense
share this conference, and thank you very much to your colleagues,
les questions de santé.
excellencies.
Encore plus,
There is something which is very dear to my heart, in addition to
c'est un sujet de confiance.
how important health is. There's something which is very important when health is concerned, and that's trust. The trust that a patient will place in his or her physician. And COVID has indeed caused tremendous upheaval in everyone's lives, but has shown both continents
Une autre histoire. Et moi, je suis témoin de deux premiers jours.
that, and I was first-hand witness to this, has shown that this invisible virus
Et je pense
is in fact a bridge. It was bridge between our continents. And we now have a new partnership between the African continent and the European continent. And now, why do I say this? Well, because quite often, African countries criticize for having a mentality where, we would show up and then we would say what needed to be done. Well, who knows what needs to be done, if not to the people who are directly in the line of fire? I have to say that when the virus appeared in Europe and the lockdown was decreed, this was back in March of 2020. And I recall clearly that 3 weeks after that, the French president, Mr. Emmanuel Macron, along with Dr. Tedros, said that something had to be done so that once the vaccine was ready, we could distribute it. So we needed a solidarity mechanism, which is why Act A was set up and then was renamed COVAX. And President Macron enlisted the support of the European Union, and we started to establish this network. By the way, at the time, America was saying, the U.S. were saying America first, and we were leading this movement single-handedly, and it was quite frightening. There was a great deal of concern about how this would go, how this would play out in Africa. So France, and this is why I'm particularly happy to be here today, France determined that solidarity should be demonstrated. That's one thing. And then when we got the vaccine, when it became available, and when we started to vaccinate people, President Macron once again took another risk. He took a political risk. There were few doses of the vaccine available in France. It was just the beginning of the vaccination campaign. And that was when President Macron said that the first people who needed to be vaccinated were the medical staff of the African continent. This is something that we must remember. And quite soon after that, President Macky Sall traveled to Brussels and spoke before the Commission and said that there was a need for support in the production of the vaccine in Africa, which is how, this was back in 2021, in April 2021, well, 3 months later, we traveled to Senegal, France, Germany, and the European Union as a whole. Traveled to Senegal. Now, what is the point of this reminder? Well, the fact is that the minister has said the question emerged about over ownership. Who owned the solutions? It would be unacceptable for Africa to only be able to produce 1% of the vaccines they needed. And the solution emerged in Africa. The proposals emerged in Africa. And the European Union supported the emergence of those solutions technically, providing the necessary skills. And we started to co-build, to cooperate in the form of the new partnership. I'll give you a few examples.
L'agenda a été poussée Maintenant, on voit que les travaux avancent pour produire
decided that things were coming along. There were
l'Institut Pasteur qui l'a déjà initié.
RNA vaccines, but there were other vaccines. The Pasteur laboratory had other designs, and we participated in a project whereby 70% of the necessary doses could be produced. So the point here is that the fact that the Rwandan and Senegalese ministers of foreign affairs are here today is a natural consequence of the fact that their ministries have decided to invest into health. That is critically important. Rwanda and Senegal rose to the challenge successfully. The Pasteur Institute, the Pasteur Laboratory, has continued to grow. What was lacking in Africa was the regulatory framework, and there is now going to be an African Medicines Agency, which will be like the European Medical Agency. It will be a sister organization, and we can cooperate together. So,
Ce qu'elle a changé, si je peux dire, Héloïse, vous voyez que
Eloise, what's changed? It's a new chapter opening up in our relations, and with the summit meetings on other subjects, such as we've got nowadays, for example, it's going to be dealing with agriculture, questions to do with energy matters. In other words, we're starting to give real support, not to impose things, but to support. And that's why I'm very pleased, because all three of us have been working towards the success of the summit, but you've got three people here who were on the front line. We were all there to write our contribution in this new chapter of cooperation.
Take some questions from the floor, so get thinking about that if you have some. But just building on what Minister Zacharopoulos said, I'd like to ask Minister Talsal, what are your ideas for what do you think should be the priorities for European, African, inter-regional relations insofar as building a future where we can be prevent the thing, learn from the best practices from the COVID-19 response?
Thank you, Eloise, for these critical issues. You mentioned it. Je voudrais juste dire que
Let me just say
l'Union européenne et l'Afrique
that the European Union and Africa are condemned to cooperate. There's no getting around it. That's clear. There's nothing else, no other alternative. So Europe is the closest continent to Africa. It's a continent that's got the longest history with Africa. All European languages are spoken in Africa: French, English, Spanish, Portuguese, and others too, probably, that I haven't mentioned. Greek, that'll come soon. So, we basically have to cooperate. We're already starting to cooperate, but as the minister was saying, as Chrysoula was saying, we have to identify matters of urgency so that this cooperation can shift to those domains. And what we've learned from COVID is that, yes, we can understand that in a given area, I mean, yes, you've just referred to Ukraine, that's true. We have to identify the areas where cooperation is vital. Health matters, for example. In Senegal, for an awfully long time, we have had an organized health system. There's a lot of preventive action. An awful lot of preventive actions are there.
Du traitement.
Perhaps 50% of treatment is prevention. And as I speak to you now, I can say that there's an initiative being taken in Senegal. It's been in existence for a long time, although some countries are only just discovering it now. And it gets an awful lot of support, for instance, from the Susan and Warren Buffett Foundation. The Batu-Nugor is a local hub. In other words, throughout the entire country, in any place, there's someone who's there for women and children so that the message can be put across at that level as regards good practices throughout the country. If there's just a nurse and a midwife, there'll be a Batanagor who's going to be set up. And if there's a difficult situation, they'll see, particularly for, I mean, I'm not a doctor, but I know that it's particularly for women who've never yet had a child. And these are women who understand what's happening. They can see that there's a problem with the pregnancy and there might have to be a cesarean, and they can issue the initial alert so that the woman can be referred to the doctor, and the cesarean is something that requires a surgeon. It can't just be a local doctor who does it. So that's how Senegal is organizing itself in terms of prevention. Now, as regards the actual structure, you haven't got a single village in the country where you don't have a health structure in place. You've got the teaching hospitals, for example, where there's research, teaching, right down to a health hut, where you've got, through the venom of a snake, the first aid in some instances. So that's what we have. But we still need support, as Chrisulu was saying, in 2021, when there was the visit. I mean, that's where we met, actually, in Brussels. And our president said, we want to comply with international standards. If a corporation is to provide us with anything, then it has to be that we're no longer the African countries just handing out vitamins and aspirins. We have to be manufacturing drugs. So that's what's happened. Cooperation with the African Union, with other donors, BioNTech, whether you're in Rwanda or in Dakar or wherever. Throughout the continent, there are going to be factories manufacturing the same drugs, mRNA drugs that are produced elsewhere. What's important as well is a question of regulatory issues. In Senegal, we realized that our most recent legislation goes back to 1954, in other words, when we were a French colony, and it hasn't been reviewed and revised since then. So what we're doing is we're going through it all, largely through the Lama Treaty, which I presented to the National Assembly. So everything has become a question of cooperation and diplomacy, because it's an international concern. It's a matter to do with cooperation. So that's what Senegal is doing, and that is what Senegal expects from cooperation. But that's also what Senegal is doing for cooperation, because what we're doing in Dakar is not just for Senegal. It's for all of Western Africa and the whole of Africa. So we're seeing where all of the vaccines are going to be going in the region. Africa is manufacturing for Africa, it's purchasing for Africa, and it's consuming for Africa. And Africa is treating Africa. And that's precisely what we're doing, obviously with the support and help of our partners. Thank you.
I can ask you, Minister Biruta, the same thing. What, from the Rwandan perspective and from your perspective, do you see as the most important building blocks in that inter-regional cooperation now, particularly between Africa and Europe?
Yes, I have said it, but the main building block is just to have that ecosystem in place. And we are cooperating with the European Union at various levels, at the technology level, but also at the regulatory level, because we are partnering with the European Medicine Agency to be able to strengthen our regulatory framework and support the African Medicine Agency. But if you allow, I can also refer to specific initiatives which go in the direction of supporting the ingredient and the building block we just referred to. One is related to the skills development. We have established in Rwanda recently the African Biomanufacturing Institute, just to serve the purpose of training, reskilling, and upskilling the professionals who will be needed in that particular sector. Second initiative, which was launched last week at COP27 in Sharm el-Sheikh, it is the Pharmaceutical Equity for Global Public Health Initiative, which was launched with the support of the European Union and will serve as a bridge to strengthen South-South cooperation with the aim to developing and manufacturing 60% of all essential contemporary pharmaceuticals, not only between Europe and Africa, but within Latin America, the Caribbean, and Africa by 2040. So the partnership goes beyond Africa and Europe. It is a global partnership which is being established just to have that capacity to produce vaccines and other pharmaceuticals, but across all the continents. So this is very important, and I wanted to mention these important initiatives. Thank you.
Fantastic. I'm very glad you did. That sounds brilliant. If I can now turn to our audience, are there any questions from the floor for our panel? I'm sure there are. S'il vous plaît. Please. I think someone has a has a microphone.
Bonjour, je m'appelle Charline Capita, je suis franco-congolaise qui...
I'm a Franco-Congolese living in France. I'd like to thank you for everything you've said, all of you, and the time you're devoting to us. I'd like to say something about intellectual property, pharmaceutical patents, and so on.
Est-ce que vous travaillez déjà dessus?
Are you already working on that? And what about cooperation issues in industrial property or intellectual property? It's not really well developed or shared out. So in health, is there anything specific that's been done on this? Thank you.
Merci. I'm just going to see if there are more questions, then we can take them together. Got two quickly here, then I'll turn to the panel.
Bonjour à tous. Moi, c'est...
Hello, my name's Hipoka. I'm from Senegal. So I'd like to greet particularly Madame Talsal, our minister. I have a question. We're talking about health here. I come from Fouta, and there are quite a lot of plants that we use for healthcare there. Do you have any solutions as to what can be done with those sort of plants to provide a response to quite a lot of disease and illnesses? So that's my question. Thank you.
Merci. Last one.
Thank you.
Bonjour, merci beaucoup, Penelope Silis.
My name is Penelope Silis. I've got a question concerning the awareness campaign for people, encouraging them to be vaccinated. Are you also working on that in a cooperative fashion, and if so, how? Thank you.
Merci. I'm just got an eye on the time, so if I can ask for pretty much des réponses assez brèves.
I would ask you all to be fairly brief in your answers.
Take the first one on propriété intellectuelle.
For 3 questions or only for one?
Maybe pick one.
What do you want me to do? The first one? Parce que j'ai envie de répondre à toutes les questions.
Actually, I'd like to answer all of the questions. No.
Rapidement.
Quickly.
Oui.
Okay.
Very quickly.
Alors, tu me connais, je vais pas changer.
You know, and I'm not going to change here. You know how I like to speak.
La propriété.
Okay, intellectual property. That's extremely important. On the question of vaccinations, we were blocked on that particular point. And what we had to do was to get the WTO involved to deal with the question of patents on vaccines. We've made some progress. We're sort of halfway there, but we're on the way. So it's an important question. We're dealing with it, and it's as the African Union on continental level that we're dealing with this.
de Bokar, mon compatriote.
And then from my compatriot, and I'd like to say hello to him, you asking about phytosanitary, there's plant-based health. Yes, of course we do, because it goes hand in hand with science, but phytosanitary work has to be scientific. In other words, scientists have to be there to authorize it. Artemisia, for instance, that's a plant that people think can replace Nivaquine, Clovaquine against malaria. A lot of people use Artemisia, but you have to have the correct dosage and so on. So there's a scientific facet that has to come hand in hand for all of these plants to make sure that they are without any danger and still used to cure people. Last one, awareness campaigns. That's extremely important.
Comment est-ce qu'on appelle les sceptiques au vaccin, là? Vaccino-sceptiques?
The vaccine septics, well, you get them everywhere. I mean, you've got conspiracy theorists who say COVID doesn't exist, it was something that was invented, so you don't need to be vaccinated. So, yeah, there's been a certain amount of reluctance, but we have to make people aware of what's going on. And the example of Senegal is a very interesting one from this point of view, because we've got a strategy in place. Public health, well, in public health, there is an awareness facet that is vital. So we have to make use of it. There has to be the right sort of communication strategy. You have to target people. You have to have community influencers. We draw on all of these sources in order to make people aware. It's never enough, that's true, because of the fake news issues, conspiracy theorists and everything. You know, the more you try and fight for vaccination, the more they speak out against. So you've got to keep battling on, show determination, never give up, and continue the battle. Thank you.
Thank you, merci. Minister Bruta.
Maybe a comment on the first question on intellectual property. I think I'm going to give just my personal view. It is not, I'm not speaking on behalf of the continent or my government, because it is a topic which is still under discussion. On one hand, it looks unethical when someone has a product with intellectual, which is covered by the intellectual property, while he doesn't have the capacity to produce for all the world, for the world. So that is a problem. But on the other hand, we know that there is an investment which is made in research and development, and that those who invested in the creation or the production of a specific product need to get paid back for the investment they made. And we know that there is a need for incentives for those who are doing research, scientific research. So my view is that when we want the intellectual property to be lifted just for us to be able to produce enough pharmaceuticals, enough vaccines for the world, I think we need to think about the compensation, a compensation system for those who developed the product, for them to be able to release the intellectual property for a massive production. That's what I think. But to say that just we need to lift it just to be able to, for everybody to be able to produce without thinking about the investment which was made in the development of a specific product, I think it will even have a negative impact on the research aspect. And we need research. We need to invest in research for us to be able to have new products for the new pandemics we will face in the future. So that's what I personally think. It is still under debate, but for me, we should have a compensation system in place to be able to just to get intellectual property lifted for those products the world will need massively at a certain time. Thank you.
Thank you.
You have to think that Vincent is a very great scientific man. It's why he's speaking as we say. So I agree with you too.
And if I may pass the word to Minister Zakharopoulou for answers to the questions, and that will be our final contribution to the floor in this session. Minister, over to you.
Je voulais simplement ajouter, si vous me permettez.
If I may, I'd just like to add something.
Aussi, là, c'est une victoire.
We can say that there's a victory here thanks to the Euro-African axis. And it's something I've experienced myself.
Comment s'appelle l'Organisation mondiale du commerce.
Yes, I'm talking about the World Trade Organization.
Avec Madame Ngozi, non?
With the Director General, Madame Nguzi. You know that there's been a problem because
Parler de biens publics communs, mais
the President has been talking about
à la fin sur ça.
public
Parce
goods,
que je me souviens,
but there wasn't total agreement around this.
France
And I know that we,
encourageait
in France certainly, we were constantly encouraging health innovation. As has been said by the ministers, it's really very important that scientists should have the
inventer des choses.
freedom to work and to develop things.
En même temps, c'est ça la difficulté.
But at the same time, and this is where the difficulty lies,
La question soit un obstacle.
we shouldn't have intellectual property which is an obstacle that prevents local production. That was the difficulty we were facing.
Il y a la licence volontaire.
So we know that this is a voluntary license system.
On a eu cet exemple avec AstraZeneca.
We've had the example with AstraZeneca and laboratories in India, and that worked.
mRNA.
That wasn't the case for mRNA because it was a new technology there, and there was quite a controversy around that until the South African president made a very hard-hitting speech addressed at us. But when we had the EU-AU summit, there were certain members of the EU, not France, that didn't want things to change. But working together, it ended up that Ramaphosa and the Europeans did reach a deal. Because you know how difficult it is to do this at WTO level, where all states have to be in agreement. And it's actually thanks to this, as it was done, that it's now become easier. I mean, there are compulsory licenses that exist, but we've got a much more flexible system. So all of that to say that, as the minister was saying, we've got this shared history, the fact that we know each other.
Chacun les passés.
We're sort of working through and making reparations for the past. So it means that the younger generation sees Africa in a different light, and the strength of the African continent is its youth.
Nouvelle dynamique.
And they are there to create a new dynamism.
La brutalité. Moi, je suis sûre.
And I'm pretty convinced that if our continents work together, we can spread our values, our shared values, to the rest of the world. That would be my message.
Thank you. We've heard about developments in Africa, developments between the two continents of Africa and Europe, and indeed beyond. It just leaves me to thank you, our distinguished panel, for your time today, and thank you to our audience and the Paris Peace Forum for putting on this brilliant session. Thank you so much. Let's have a hand for our brilliant panelists.